I'm Dr. Prashanth B. Nirvani Rao. I'm the consultant gastrointestinal interventional endoscopist and fellow of American Society for Gastrointestinal Endoscopy. I'm also a fellow of International College of Surgeons. I'm practicing at Chaitanya Gastrointestinal Care and Endoscopy Center at 4th Cross Care Extension, Tumkur. I'm practicing from past 30 years in Tumkur. I'm mainly concentrating on gastrointestinal diseases, digestive diseases, digestive endoscopy, colonoscopy, and other diseases which are related to digestive system. World Hepatitis Day, 28 July. Bringing hepatitis care closer to you. I can't wait. These are our aims. Liver is a very important organ. Why? Because it has a lot of functions which the body requires. It removes potentially toxic byproducts, that is the detoxification, and it metabolizes or breaks down nutrients from the food. It maintains composition of the blood so that all the organs can perform efficiently. It helps body fight infection by removing bacteria from blood, helps in restoring vitamins and minerals like vitamin A, D, E, vitamin B12, iron and copper. It carries hormones and vitamin enzymes throughout the body, produces proteins, albumin and clotting factors needed by the body, produces bile and which is helpful in the digestion of the fat and also in the absorption of vitamin A, D, E and K. It removes excess glucose and stores it as glycogen. If needed, it can also convert this back. Why we have chosen July 28th as Hepatitis Day? Because it's the birthday of our Nobel Prize winning scientist, Dr. Barack Bloomberg, whose pet name was Barry Bloomberg. He is the guy who discovered hepatitis B virus in 1966-67 and developed a diagnostic kit for the same and also a vaccine for this virus. Why are we concerned about hepatitis so much? As I am talking to you, every 30 seconds a person dies from hepatitis. There are 350 million or 3.5 crore people who live with viral hepatitis. 9 out of the 10 people living with hepatitis are unaware of their disease. Hepatitis B, C and D lead to almost 1.5 million deaths per year or 11 lakh deaths. Greater concern because of the burden of the illness and its complications, which include fibrosis or hepatitis, cirrhosis, finally cancer and hepatic failure with death. Theme for 2022 is I Can't Wait. Awareness on cause of the disease, prevention, then detection, early detection, immunization and treatment which cannot wait for anyone. Aim is to eliminate hepatitis by 2030. I can't wait is the theme. Hepatitis patients can't wait for life-saving treatment. Expectant mothers can't wait for hepatitis screening or treatment. The newborn babies can't wait for birth dose vaccine. People affected by hepatitis can't wait to end the stigma and discrimination. Community organizations can't wait for greater investments. Decision makers can't wait and must act now to make hepatitis elimination a reality through political will and funding. Now let's know what is hepatitis. It's the inflammation of the liver. It is called the hepatitis. What are the common causes? The most common causes are viral, autoimmune, medications, drugs, toxins and alcohol. Today we will concentrate mainly on viral hepatitis. Once the normal liver is affected by a viral infection, mainly hepatitis B and C, it can cause fibrosis. Hepatitis first, chronic hepatitis, then there is fibrosis or stiffening and it can progress to cirrhosis. Once cirrhosis is not treated properly, it can progress to the cancer of the liver called the hepatocellular cancer or the HCC. Finally, it can cause liver failure and even death. What are the types of hepatitis we have? Hepatitis has 5 types of the viral hepatitis. They are hepatitis A, B, C, D and E. Each of them is caused by separate virus. For example, hepatitis A is caused by hepatitis A virus, B by hepatitis B virus and so on. So we'll know the types, transmission and prevention. Hepatitis A virus is spreads by contamination of uh, fecal-oral route, that is feces of the infected person, when it comes in contact with the water or food and the other person who ingests this, and it comes through this route. There is a vaccination available for prevention of hepatitis A virus, and also good hygiene, washing hands after stools and washing hands before eating, and keeping everything clean with good sanitary methods and personal hygiene. Treatment, there is no specific treatment. It requires rest, good hydration. Then some cases only people, because of dehydration, they may need hospitalization. Otherwise, most of the time it settles. Next comes hepatitis B virus. Hepatitis B virus usually spreads by contact with blood and blood products or some body fluids. What is the prevention? So people who are sharing razors, knives, in drug addicts, injection needles, then when a patient or anybody receives blood or blood products, it has to be screened. And it also can spread through sexual contact where a person is infected. In such types, they have to take protection by barrier methods. It's also common in multiple sexual partners as well as homosexuals, where the sexual protection by barrier has to be taken care. The treatment is available, is it? Yeah. It has antiviral drugs and also nucleotide analogs like pegylated interferon. There is no cure, but it can be stabilized. Next is the hepatitis C virus. How it spreads? It also spreads similar to hepatitis B through blood and blood products and some body fluids. Again, prevention is by screening of the blood and blood products, to use sterile needles and for drug injection, sanitary care, and whenever you go to a body piercing artist or a tattoo artist, again the sterilization is very important, and try to use disposable things. Is their treatment available? Yeah, hepatitis C virus has recently, in past 2 to 3 years, that is cured. Direct acting antiviral agents with or without pegylated interferon. Then the next virus is hepatitis D virus. And this hepatitis D virus usually affects the people who are already have hepatitis B virus, because this D virus needs hepatitis B virus for replication. How it spreads? Again, it spreads similar to B and C, that is through blood and blood products from the infected person, through unsafe injections or transfusions or other sexual activities. So prevention, blood screening, sterile needles for drug injections, and safe sexual methods. Treatment of chronic hepatitis D can be treated with interferons. Next comes the hepatitis E virus. It is also spreading like hepatitis A virus by the fecal-oral route. Spreads through, and also through uncooked meat or fish. So there is again improved hygiene, food sanitation, practice of safe sex. Try to have good protected water. People have to wash hands properly after using toilets, and also clean, to keep the toilets clean, washed. And is there a treatment? Hepatitis B benefits sometimes by in other in acute cases. It requires treatment, rest, good hydration, good sanitary care, and in some cases may need riboflavin or antiviral drugs. Now we'll see what are the common symptoms of hepatitis. Signs and symptoms of acute hepatitis appear quickly. In chronic infection, the symptoms will appear very late. So what are the acute symptoms? These include fatigue, dark urine or pale stools, flu-like symptoms. There may be stomach pain. There can be loss of appetite, unexplained weight loss, jaundice, that is yellowish skin and eyes. Some people can also have joint pain. Some people can have vomiting and diarrhea. So hepatitis A virus. How is the transmission of hepatitis A? When there is close contact with an infected person, traveling to countries more prevalent with hepatitis A, eating sausages, contaminated raw shellfish, and drinking polluted water. Hepatitis A prevention. The vaccine is our best defense. Get yourself vaccinated, especially before traveling to countries with higher incidence of hepatitis A. It can be prevented. What things to be done? Maintain good hygiene. Frequently wash your hands with soap and water and take rest. What we should not do? Do not have food or water from places with poor sanitation. Avoid unprotected sex with multiple partners. Do not prepare food for other people if you have the infection. So hepatitis B transmission. You are at risk of getting hepatitis B infection if blood, semen or other body fluids from a person infected with the virus enters your body. So like infected blood transfusion, having sexual relationship with multiple partners, in birth from mother, it can pass to the child, and sharing needles and razors. Distribution of hepatitis B virus. Geographic distribution of chronic hepatitis B virus. You can see the countries with red have high prevalence of about more than 8%. Intermittent countries with yellow have 2 to 7%, and less than 2% prevalence have in green color. Hepatitis B is fairly common in India, ranging between 2 to 8%. The high risk groups for HBV infection are people with endemic regions, babies of mothers with chronic hepatitis B, intravenous drug abusers, people with multiple sex partners, hemophiliacs and other patients who require blood and blood products for treatment, and healthcare personnel who have contact with blood, residents and staff members of hospitals. So concentration of hepatitis B virus in various body fluids, high in blood, serum and wound exudates, moderate in semen, vaginal fluid and saliva, low or not detectable in urine, sweat, tears and breast milk. What's the possible outcome of hepatitis B infection? Acute hepatitis B infection in 95% of the infant goes to acquired infections, and 3 to 5% of the adult acquired infections leads to chronic hepatitis B virus infection. Then this chronic hepatitis in 12 to 25% in 5 years can go to cirrhosis. In this, 6 to 15% in 5 years may develop hepatocellular carcinoma and finally death. On the other side, this can also in 20 to 23% within 5 years can develop liver failure. Before this, there is an option of liver transplant which may give a good life for some more years. And again, liver failure can lead to death. So hepatitis B prevention. Vaccination against hepatitis B is the best. Here are some precautions that will help combat the infection. What things to be done? Visit your doctor regularly if you have hepatitis B. Use disposable needle or syringes. All family members of an infected person should be vaccinated. What you should not do? Avoid unprotected sex. Avoid sharing of razors, toothbrush, needles and injectable tools, and avoid alcohol. So treatment for hepatitis B. Drugs are available to treat this hepatitis B. Oral antiviral. These drugs are available to limit the virus replication and provide good control of the disease. Oral drugs need to continue for long term. Interferon injections. So 1 year finite therapy with a chance to cure the disease. Then interferon alpha 2. These are the substances which are produced by cells to fight infections and tumors. So goals of antiviral treatment of chronic hepatitis B: sustain suppression of HBV replication, so decrease the serum hepatitis B DNA to less than 1 lakh copies per ml, then HBeAg to anti-HBe seroconversion, HBsAg to anti-HBs seroconversion, then remission of liver disease to normalize of serum ALT levels, then to decrease the necroinflammation in liver, improvement in clinical outcome, that is, decrease the risk of developing cirrhosis, liver failure or hepatocellular carcinoma, and to increase the survival. What to do in a HBV carriers? 1. Avoid alcohol, consult doctor regular intervals, and follow proper balanced diet. Transmission of hepatitis C. Hepatitis C spreads when blood contamination with hepatitis C virus gets into your bloodstream. This can happen by high-risk transmission, either sharing injection drugs or needles, getting a tattoo or piercing with unclean equipment, and medium-risk transmission, at birth from mother, it can pass to the child, having sexual relationships with multiple partners, sharing personal items like toothbrush, razors, and nail clippers. How to prevent hepatitis C? There are no vaccines to prevent hepatitis C. You can avoid getting the virus by Using a latex condom every time having sex if you have multiple sex partners. Don't take precautions while getting tattoo, body piercing, or manicure. Do not share personal items like razors, etc. Do not share needles, syringes, or other tools when injecting drugs. Get your blood and blood products screened. Hepatitis D. Transmission of hepatitis D. It transmits through close contact with the infected person, often occurs with hepatitis B infection. So hepatitis D virus needs the B strain of hepatitis to survive. This can happen in two ways. It can be co-infection or there can be superinfection. So co-infection, hepatitis B virus and hepatitis D virus at the same time. In superinfection, hepatitis B first, then later come down with hepatitis D virus. This is the most common way to get hepatitis D. Prevention of hepatitis D. The best way to avoid hepatitis D infection is by minimizing the risk of getting hepatitis B. Follow all the preventive measures of hepatitis B. Talk to your doctor about hepatitis B vaccine. Avoid contact with blood or other body products of someone with hepatitis. What you should do: wear gloves if you have to touch someone else's open wound or sore. Keep personal items like toothbrush and razors separate. Don't share needles. Avoid alcohol. Hepatitis E. Transmission of hepatitis E. The hepatitis E virus spreads through feces. It can also spread through uncooked meat from infected animals such as pigs or deer. Hepatitis E prevention. Avoid the use of contaminated water or ice. Avoid eating uncooked pork or deer meat or raw shellfish. Frequently wash hands with soap. In most cases, hepatitis E goes away on its own in about 4 to 6 weeks. Following measures can help ease the symptoms. They are: rest well, drink lots of water, eat healthy food, avoid alcohol. 3 Ds of hepatitis education: do's, don'ts, and diet. Do's: family vaccination, follow medication on time, consult your doctor at least once in 3 months. What you should not do: sharing needles, razors, toothbrush, blood donation should be screened every time, taking over-the-counter drugs without doctor's prescription. The most impact of hepatitis B is in liver, so it is important to follow a healthy liver protective diet. Whole grains, vegetable, fruits, pulses to be consumed more. Healthy proteins like low-fat milk products, chas, buttermilk, mutton can be a part of diet along with lean meat and eggs. Whole milk and full-fat dietary products such as cheese, butter, cream, fried fruit, and junk food should be completely avoided. Alcohol should be stopped completely. Precautions and advice for liver cirrhosis patients: should visit your doctor regularly, use over-the-counter medications carefully. Medications to control hepatitis may limit further damage to liver cells caused by hepatitis B. Eat healthy diet, eat low sodium diet. Stop cirrhosis. Thank you. Uh, Please follow us on social media, that is on Instagram, Facebook, and also YouTube. You can follow all activities of Chaitanya Gastrointestinal Care and Endoscopy Center on this.